Safe work procedures. Loading and unloading patients into EVIS Beechcraft 1900D. 1. Complete a visual inspection of the loading area and note any hazardous conditions. For example, slip, trip, and fall hazards, malfunctioning, broken, or missing equipment, etc. 2. Report hazardous conditions to the supervisor and document using the Provincial Incident Employee Investigation Reporting System, PIRS. 3. All 6 people must actively participate in this task. The 2 medical flight specialists, the 2 paramedics with the ground ambulance, and the 2 pilots. 1 individual stays at the foot of the stretcher to stabilize same during the transfer. 1 individual stays in the aircraft to receive the patient. This is often one of the pilots. 4 people position themselves on either side of the stretcher, 2 at the patient's upper body and 2 at the legs. Where possible, staff should endeavor to position themselves across with someone of a similar height to ensure an even lift. 4. The 2 pilots are responsible for opening and closing the loading door of the aircraft and assembling or disassembling the lift platform. 5. The 2 ground paramedics will push the stretcher to the aircraft, will raise the stretcher to its maximum height, and will position same such that the patient's head is towards the end of the lift platform. Brakes will not be applied as the stretcher will be moved quickly for the 5th person to assist with the transfer. Note: if the patient is bariatric, 4 staff will assist to raise the stretcher to its maximum height. 6. 5 staff will position themselves around the stretcher. All individuals will be positioned with a wide stance while ensuring that their spine is properly aligned, with the abdominal muscles contracted to support the spine. 7. The person stabilizing the stretcher will be the designated in-charge person and will verbally coordinate all movements through loud and clear communication. 8. When directed, the 2 individuals at the head of the stretcher will pull in the handles under the middle of the aerosled to retract the clips and free the sled for movement. These 2 people then lift the aerosled approximately 2 inches to free the sled from the clip deck, while all 4 people laterally move the aerosled onto the lift platform. The in-charge person will communicate with the staff when alterations to the aerosled's positioning is required, i.e. shifting it to the side or lifting higher. 9. As directed by the in-charge person, the 4 people continue to laterally move the aerosled onto the platform until the 2 individuals nearest the aircraft say stop, indicating that the top red metal frame under the aerosled has reached the marked areas on the platform, currently marked with yellow tape. At this point, the person at the end of the stretcher will move the stretcher away from the end of the platform and will position themselves at the end of the aerosled to assist with lifting the end up approximately 2 inches over and into the locking system on the lift platform. Note: staff should keep their upper arms close to their bodies, with their palms facing up during this movement. Lateral movement of the aerosled should occur with steps to the side, rather than twisting of the trunk and lateral reaching. 9. Once the aerosled is fully on the lift platform and locked in place, one of the pilots will raise the mechanical lift platform. 10. While this lift is occurring, one of the medical flight specialists and the 2nd pilot will then move into the aircraft to assist with sliding the aerosled along the 90-degree turn of the track and into the life port station, locking the aerosled into place for flight. 11. This process is reversed when unloading a patient from the aircraft. When unloading the aerosled, the height of the stretcher should be positioned lower than the ramp to allow gravity to assist with the transfer. The brakes of the stretcher should be engaged. The person who has remained in the aircraft will be the in-charge person, coordinating all movements.